I'm Dr. Lisa Nelson, and I'm the medical director for the Nutrition Center. The Nutrition Center is a 501(c) nonprofit organization that provides individualized nutritional counseling, cooking classes, and nutritional education to children and adults throughout Berkshire County. Over the last 2 years, the Nutrition Center has delivered services and more than 400 cooking classes to Berkshire County residents. More recently, since October, we've been doing cooking classes at the Christian Center in Pittsfield and also at the Conti Community School, as well as providing individualized nutritional counseling. This proposal, in which we're asking for $32,750, which is about 60% of the total program budget for Pittsfield. I'm happy to say that we recently found out that half of the remaining 40% has come in through another grant, the Catch Grant. It would allow us to expand our current programs so that we would approximately double the amount of individualized nutritional counseling that we can offer, but more importantly, that we could increase the cooking classes by about 8-fold. And the reason that we're focusing on the cooking classes is because they're a very efficient and cost-effective way to reach the largest number of people to provide the nutritional education. And I'm going to talk about more why I think that's important in a minute. Our community partnerships or collaborators include the Christian Center, Redfield House, Kid Zone, and the Junior League of Pittsfield. We're also in conversations with some other groups as well, but those are the ones that are on board currently. And the collaborators will provide the site of the classes, as well as help with registering participants. And the Nutrition Center will really provide all of the services. So the food, the materials, the instruction, the surveys, and the evaluation. In addition to the cooking classes, the grant will allow expanded access to the individualized nutritional counseling. Currently, about 30% of the people that are referred to the Nutrition Center are not covered by insurance. So either they have no insurance or their insurance is inadequate to cover the services that we need and that they need. So having a scholarship pool will help close the gap for people who lack the necessary insurance. And so to talk about the impact for Pittsfield or the need for these programs, I want to talk about my own involvement a little bit. As I said, I'm a physician in Pittsfield. I work at Family Practice Associates on Elm Street, and I've been here since 2005. And I'm actually the volunteer medical director. I asked Peter, who is the director of the Nutrition Center, if I could become involved because I was so excited about what they do and what they offer, and because the need is so great. When I graduated from medical school, I had no intention of focusing on nutrition. You know, it's not taught particularly, and it wasn't a particular interest of mine. But I can tell you that after practicing for 10 years, I am amazed and struck by how lifestyle, and in particular food, is really behind the public health crisis that we're facing right now. And I don't want to bore you with a lot of statistics, but just as a framework, and these are national statistics, and I can tell you that Pittsfield is a little bit worse. But we have greater than 30% of all adults are obese. Greater than 34% of all adults have what we call metabolic syndrome, which is a precursor to the development of hypertension, coronary artery disease, and diabetes. Okay, so that's more than a third of adults in this country already have this disorder, which then leads to the development of serious health disorders. In 2010, more than a quarter of older Americans, so over the age of 60, already had diabetes. So this is just an incredible health crisis that we're in, and it's not abstract. You know, when you're working with people who have a debilitating disease, it affects happiness, it affects employment, it affects the family structure. And so that's what really made me more of a food activist over the last several years. And the reason that I find the nutrition center's work so exciting is because I think for a long time we have hoped that the medical establishment would address these issues. And I can tell you, as a practicing primary care provider, that we do not have the tools or the time or the support. Okay? We have like 10 or 15 minutes to talk with people about health problems and mood and family and medications and all of these things, and it's just not enough time, even for someone who cares, like myself, to get into it. So when I found out about the nutritional counseling, I said, this is wonderful, and I will start sending my patients to you, children and adults alike, because it's so important to have the time to really discuss these. When I found out about the cooking classes, it was even more exciting because advice, I'm sure this won't be shocking for people, advice is not really what helps motivate people to change. You know, experiences, and especially a positive experience. And a cooking class really brings the joy back to food. You know, so when somebody has a chronic health disease or condition where they know that food has been part of the problem, it really starts to make the process around food less enjoyable. And it also brings in a whole host of other skills and important processes, especially with a low-income population, which is who we're working with in Pittsfield, that are really important. So for instance, with the kids get exposure to fruits and vegetables, they get these important skills. With the skills come a sense of personal responsibility and empowerment. They want to be in the kitchen, they want to be in the kitchen with mom and dad, and it helps promote family meals, for which there's also a good deal of data that maybe people here already know about that show that families that eat together are more likely to stay intact, the kids are more likely to avoid drugs and trouble. I mean, all of these things really come together. They're also a tremendous amount of fun, you know, and that's really how you get people to change, is by engaging them in the process. So those are the programs for the kids. For adults, we spend a lot more time focusing on making the connection between health and food. So there's the cooking skills on the one part, so that people can actually prepare meals from scratch at home at an affordable cost. And then there's also raising awareness about how a lot of the food, the processed food, refined food, high in sugar, really promotes disease like diabetes and heart disease. And for instance, two of the cooking classes that were recently done at the Christian Center, one focused on crock-pot cooking. Okay, so that's ideal for a working family where they can get the food in the crock-pot in the morning and come home and have dinner together instead of stopping off at fast food. The other class that I thought was brilliant was going to a food pantry and creating a healthy meal from what is offered there. Because again, it's like shelf-stable processed foods are so often what people turn to, because if they lack the knowledge about how to turn beans and rice into a healthy meal, they're not going to do it. But the truth is that these, healthy meals can be made in an affordable way. Do I have time to talk about two people who have been affected?
Sure, real couple minutes.
Okay.
Yep.
So I recently had one Pittsfield resident go through the cooking classes at the Christian Center. She is a 54-year-old transgendered female with heart disease and diabetes, and she has really been trying to improve her health. And she's very motivated, but she does not have a lot of monetary resources. And so this class was wonderful for her. And as a result, she and her partner are moving towards a vegetarian or a vegan lifestyle. So, that's not something that I'm going to inspire anybody to do in my office. And that for her, already with these established diseases, that could make a huge impact on her health. I have another patient who's a 68-year-old new diabetic. Now, studies have shown that with diet and lifestyle changes, somewhere in the realm of 91% of new cases of diabetes can be prevented. So again, this is huge. And so after just meeting with Peter, this was not the classes, but the nutritional counseling, she was able to lose 15 pounds, increase her awareness about the foods that were driving up her sugar, and hopefully is going to avoid progressing. So I think in terms of impact for Pittsfield, it's really multifaceted. I think that there's a way that families will be positively impacted. I think health will be positively impacted. Skills for the kids, if they get excited about learning how to cook, that can actually turn into a vocational strategy, as well as just a skill that they're going to use for the rest of their lives. And then we didn't talk about this in our proposal, but there's cost. I'm working with cities in Maine right now where they're really looking at establishing similar comprehensive programs because we can't afford, irregardless of happiness and health, it's unsustainable. So I think there's tremendous potential here, and with these grants, we could really expand access, improve access, particularly for low-income residents who are more disproportionately affected by these diseases that we're talking about. That's it for now. Any questions?
Thanks for your presentation.
Thanks.
Appreciate it very much. Questions, comments? Start over with Jason.
I actually have a quick question. In the proposal, it says that there's a plan to apply for funding through King Cross and RSF. Did those applications go in? And if so, how much?
The RSF social financing definitely went in. That was for 44. And what we're hoping to do, that was specifically around capital equipment so that we can build a community kitchen, but we're even looking at what we don't want to do is reinvent the wheel too many times, so we're also looking at collaborating with other organizations in Pittsfield who maybe already have or working together, so there aren't lots of kitchens popping up. Maybe that would be a good thing, I don't know, but, we're looking into that. And the Blue Cross? So the catch already came in, and Berkshire Life is outstanding, and we should hear any day.
Nancy, go ahead.
Thank you for your presentation. It was very comprehensive. I do have a budget question as well. So it's just in the agency budget, there's for proposed in 2013, there's an expectation of $36,000 from United Way. And I'm wondering what your expectation is. Is that from Northern Berkshire United Way, or is it from another United Way?
That would be applying to United Way, to Berkshire United Way.
To Berkshire United Way. Okay, so I can tell you that won't happen because we don't have an application process again until 2014. It'll start in 2013 for funding for fiscal year ending 2014. So, just so you know, if that's going to affect your budget for 2013.
Planning.
Thanks.
How old is the nutrition center? How long you been in operation?
2007.
Thanks.
But just in Pittsfield, where I think the need is greatest, just this past year.
Mary, go ahead.
Yeah, I also had a couple of budget questions. On the agency budget, on the agency budget, I noticed that the $32,750 that you're applying for is put in the current year budget, the fiscal year 12 budget, and that actually should be in fiscal year 13. So, and I also noticed for the current year, there's no salary or employee benefits or payroll taxes shown there. So I think maybe you want to just take another look at the budget and maybe rejigger the numbers. And you could give that to Bob, and he can see that it's distributed to us, because it looked to me like that was wrong. And then...
Thanks. And and maybe you can help us with, because right now we don't have a lot of full-time paid staff, or any, really. everybody is pretty much a consultant. I'm free, and everybody else is a consultant. Does that change the way we would do the reporting, or?
Well, for last year, there was salaries, benefits, and payroll taxes shown, so I assume that there's some staff being paid somewhere. It's been complete, okay. Okay, so that expense is showing on a different line then. You have more professional fees? Okay, I see that. Okay, so then the only remaining question then would be moving the what you're applying for fiscal 13 needs to be put in the fiscal year 13 column here, and then the totals recalculated. And then my other question was with regards to, on page 3 of the proposal, question 7, output, where you're showing the calculation of, the units of output and the cost per unit and the total cost. It adds up to $54,750, which is the cost of the total program. And as you said, you're only applying for about 60% of that cost. So I just wanted to clarify, is it basically that, for example, the Kids Kitchen, 100 classes, are you saying that 60% of those classes, or about 60 classes, are what the city would be paying for? Or is it some other means of allocating it? Just so that we have clear, exactly which things the city is paying for.
Yeah, the priority was in the cooking classes, and so that would be the focus for the funds that we did receive. We did receive we were awarded the other 12,000 already, and I think we will get the other 10, so I think we'll have the whole budget to work with.
But in terms of Pittsfield, you can assume 60% of those numbers.
Okay.
Yeah.
Okay. And then one last question, which isn't with reference to the budget. What's the main way that people are referred to your programs? And is it different maybe for adults and children? I was just curious because, as you say, there seems to be a great need for it. And
I think primarily for the nutritional counseling, that's physician-driven. Although people do find out, that we try to do community events when we can, and people have called the nutrition center independently to say, I need help with this. Can you help me? But I would say that the bulk is physician-driven. The cooking classes we're hoping to expand, and that's where the community collaborations really come into play. Because some people, aren't even hooked up with a physician, and so that's one thing I didn't really talk about is how the cooking classes, especially at Redfield, and the Christian Center could be a way to bring people into the system also. And that's something that Peter and the cooking instructors are prepared to do to make sure that they know about the food pantry, to make sure that they know about advocacy for access, so they can get a provider if they need it, if their children aren't covered, and to really bring in the whole family. So there's some kind of like almost a social worker piece that's happening because of the way that people are coming in, in some ways kind of top down and bottom down, and hoping to catch more people.
Okay, thank you.
John, go ahead.
I have actually more of a programmatic question. If I understand, your brochures here, which you included, and I thank you for that, it certainly sounds as if you probably are getting some referrals from physicians, talking to patients saying, I only have 10 minutes to talk to you. Here's some folks who I can refer you to. And as a paid service, I suppose there's a metric there. I guess where I was struggling a bit is for the service that you're looking at for like the kids or the young adults even, or even the adults in the community. You talk about a certain number of classes and a certain number of people, but I guess what I'm trying to understand is, are we talking about individual people? In other words, if you get a child referred to you who's maybe having some teenager, maybe some weight issues, maybe not eating real great, is the expectation that, that child will go to a cooking class, or will that child go to like 5 cooking classes over a period of time? So I'm trying to get a sense of the, the breadth, I guess you will, of the engagement with the individuals as you're, referring to. And I agree with you, engagement is the way to change behavior.
Right.
So can you give me a little bit more on that?
Yeah, so there's actually, that's a great question, thank you. And
there's a social worker in me, I can't help myself.
So there's 2 ways that it works. A lot of the cooking classes, the structured cooking classes, are supposed to be a series. So like a series of 6 that will cover a particular curriculum even. Okay. But the other thing that I love about it, and it's blurring the line a little bit, so the individualized nutritional counseling will sometimes involve a cooking class So people come in kind of from a physician who really wants more time spent on this, but then the need is shown to be there's no vegetables in the home and nobody is cooking. And so then mom and the 12-year-old come in and they have a class together. So that's where the individual classes come in. So it's still part of a comprehensive strategy. And the other thing that the nutritionists will do is have a counseling session where they walk. So it's bringing in the exercise too, which as a doctor, this makes sense for me, right? So it's just kind of bringing in all the layers all the time. So for writing out an outline, sometimes it gets hard to put everything in a box because, it.
I just think that helps a little bit to understand
Yeah.
this. So, thank you.
Thank you.
Thanks. All set? Tim? Drew? All set? So it's just this side of the table that...
Okay. That's
So
still
actually,
executive.
being a new bidder, you usually get a few more questions, so please don't feel intimidated. That was a nice presentation. I appreciate your bidding.
Well,
Thanks.
we really appreciate your time. Thank you so much.